Yeah, it's just sort of so this vortex is a bit temperamental. Ethanol, so just one joke ones. You got some of this? One of these ones. You've got a cap on the
Spit it out.
The example I've got here is Atazanavir, which is one of the second-line agents available to treat HIV. And I'm preparing drug dilutions so I can work out, fullness of time, how much drug I need to treat a certain virus. So what will produce graphs like this, and I can tell from that graph the minimum dose of a drug I need to treat a certain strain of HIV. So later on I'll be infecting some cells with HIV, but in the presence of the drug. Then I can measure the concentration of drug I need to treat that virus.
Drug resistance is the virus's way of adapting to the drug pressure on it, and as we know, HIV is one of the most mutagenic or prone to mutation organisms that we know of. It has a replication machinery that is designed to make lots of mistakes when it copies its genetic code, and therefore these mutations and drug resistance are a very, very natural and obvious consequence of suboptimal levels of drug in the patient, and that only happens really when patients don't take their medications regularly as they need to. Individuals in high-income and middle-income countries, they may have, in general, better care, but of course there are personal circumstances and social circumstances why they may miss out treatment. So, for example, they may have not disclosed to their friends and family, so they may not carry medication with them. They may have other socioeconomic issues such as housing and other competing demands on their lives, which make treatment failure more likely in these individuals. We know from previous data that certain high-risk individuals can transmit drug resistance to multiple other partners, setting up mini epidemics of drug-resistant HIV. So this is certainly a concern. The other area to note is that Eastern Europe is an area where there is a rising HIV prevalence, and unfortunately in our study we didn't have much data on the combination we were studying from patients in Eastern Europe, and we really do need more data in those individuals, because frequently the standard of care is not as it is here, and they also have problems with drug supply and often large numbers of migrating individuals. And the UK has a rising incidence of HIV, and it's worried public health officials enormously, because there are new infections in young people happening at quite an alarming rates in this country and other parts of Europe. So certainly the message has been diluted and really needs to be reinforced that this is a potentially fatal illness and needs to be prevented rather than treated if possible.